This video will go over the proper technique for creating a thumb spica splint. This splint is used to immobilize injuries to the scaphoid, lunate, and thumb, and fractures of the first metacarpal. It is also used in the treatment of dequervin tenosynovitis. First, gather your materials. You will need a bucket or basin with lukewarm water, web roll or soft cotton, stockinette, which is optional but we have showed it in this video, plaster of Paris of an appropriate length and width, an elastic bandage, plaster scissors, and tape. If possible, use gowns or sheets to prevent soiling both the patient's and clinician's clothing as well as the surroundings. First, apply the stockinette if you are using it. Stockinette is optional but does protect the skin and when folded back, creates a smoother and more professional looking padded rim. As a general rule, use 3-inch wide stockinette for upper extremities. Cut a hole for the thumb.
There are different tricks to doing this with the thumb, but this is one trick that we found particularly helpful. So we've actually used a smaller diameter stockinette and just placed it directly over the thumb to protect it.
Proceed with applying the web roll, taking care not to wrap it too tightly and to overlap each layer by 50%. Note that we are applying extra web roll to the bony prominences.
One important point for the web roll is to not wrap it too tightly because there will be significant swelling and you don't want to risk compartment syndrome in the limb. You also want to wrap it from an outside-in approach as opposed to an inside-out approach. It just makes it smoother and easier to roll.
Estimate the length of plaster you need by laying it next to the area to be splinted. Be generous as it does shrink slightly when dry, and if it's too long, it can easily be folded back at the edges. The width should be slightly greater than the diameter of the limb to be splinted. For our thumb spica splint today, we can use 8 layers of 3-inch wide plaster. We will measure along the radial aspect of the forearm from just beyond the thumb interphalangeal joint to the mid-forearm. Submerge the plaster in the water until bubbling stops. Then gently squeeze out water until the plaster is wet and sloppy. Place it over the web roll and gently smooth it over the extremity. Then fold back the underlying stockinette. So you'll notice that sometimes the plaster length that you cut is too long. That's okay, better too long than too short. In this case, it's totally okay to fold the casting material back, like we did here near the proximal radius.
You'll notice as well that I'm molding the plaster around the thumb just to make sure it's nice and snug there, but not too tight.
So you'll notice I'm showing the subject how to hold his hand. We call this the wine glass position, and it's the proper anatomic position for the thumb spica.
As you can see, folding the stockinette down over the plaster gives it that nice, neat, tidy, cuffed appearance.
Secure the plaster over the extremity with a loosely wrapped elastic bandage.
When you're applying the elastic bandage, you really want to do the same sort of thing that you did when you applied the web roll. So not applying it too tightly, overlapping by about 50%. So again, with the molding, we want the hand in what's called the wine glass position. So we want the wrist slightly extended at 20 degrees. We want the thumb abducted, and the forearm is in neutral position. You'll note here we're just making sure the subject still has full motion in his fingers, making sure he can oppose all his fingers. So just to review, we're going to gather all our materials, measure the appropriate length of plaster, apply the stockinette followed by the web roll, taking care not to apply the web roll too tightly, then the plaster followed by the elastic bandage, again not too tightly, and finally we're going to mold the splint into the position of function.